Thank you, Kimberly, and thank you so much for the opportunity to allow us to share information regarding the unwinding efforts in New Jersey. I'm going to share my screen now. You can see the presentation, right? Thank you. Okay, so Medicaid eligibility reviews resume April 1st of 2023. I'm going to give you a little background on that. Since March of 2020, when the COVID emergency started, the pandemic started, family care members remain enrolled due to the maintenance of efforts requirements during the public health emergency. Now, we always tie the public health emergency with the unwinding, but in December of 2022, Congress told all the states that we needed to start renewals again and separated that process from the end of the public health emergency. Since then, we find out that the public health emergency will end on May 11 of 2023. So all the states have 12 months to initiate eligibility renewals. New Jersey actually picked April as the last month to start the renewal. Some states started already in February. So New Jersey started in April 1st. And this includes more than 2.2 million New Jersey family care members. This unwinding represents the single largest renewal exercise in the history of New Jersey Medicaid program. What are the key messages? What members need to do? First, you have to make sure that New Jersey Family Care has your correct mailing address. Members can confirm or update their contact information by calling New Jersey Family Care at 1-800-701-0710. And once you get your renewal, please respond to any mail you receive from New Jersey Family Care right away. Those are the key messages. So here's the New Jersey Family Care enrollment. Prior to the pandemic, the economy was stable and we were actually decreasing the enrollment. It went from 1.76 million all the way to 1.7 million. And then the pandemic started in March of 2020, and we were leaving everybody in the program. And we started enrolling more. So we went all the way to 2.2 million members enrolled in New Jersey Family Care. New Jersey continued to do eligibility renewals throughout the pandemic, but we were not disenrolling anyone during the pandemic. So every time here at Medicaid, at the Division of Medical Assistance and Health Services, whenever we start something new, a new initiative, a new project, we start with guiding principles. So these are our North Star principles that we wrote for eligibility unwinding. I'm not going to go through all of them because we're going to share this presentation, but basically we have to make sure that we serve people the best way possible. We communicate with clarity and concern. We experiment with new ways to solve problems, and we work closely with our stakeholders. And we show people that we care. So here's the timeline for the unwinding. We have been preparing for this end of the public health emergency for over a year, and then now we realized that it was a separate process from the PHE. But we started outreach in 2022. There's a lot of work that has been done. But here's where we are right now, April 2023. We already started during the first couple of weeks, we started doing administrative renewals. That means that whatever can be checked systematically to renew a member, it was done already. And those members actually received a letter letting them know that their application has been renewed through the ex parte process. That's what we call it, ex parte process. And then we started mailing the renewals for those people who we were not able to check systematically through the ex parte renewal. So this is where we are, and then we expect some disenrollments to happen at the end of May. And then we're hoping that everybody pays attention to the mail and respond right away, so we will avoid many disenrollments. What will this look for New Jersey Family Care members? So we have 5 health plans organizations here in New Jersey, and the first week of the month in April, they send a postcard to all the members that are due to renew that month. So this is an example from each one of the plans: Aetna, Amerigroup, Horizon, WellCare, and United Healthcare. It just says, don't forget to check your mail. So this is something that you can help us do. If people want to know if they are due for renewal, you can ask them, did you receive a postcard from your health plan? Here's a sample of the envelopes that they should be looking for. And again, respond right away. And here's an example of the renewal applications, the cover letter and the application. Again, these are only examples. So another support that outreach effort from the health plans is that at the end of the month, they're going to be sending a text message or an email or a phone call to the members, letting them know that by now you should have received your mail from New Jersey Family Care. Please open it and follow the instructions right away. So in the beginning of the month, they send the postcard saying, get ready. At the end of the month, they say you should have received it already. Of course, we know that some people are at risk to losing coverage. So before the loss of eligibility, the health plans managers, the care managers, will call the high-risk members who have not responded to the renewals mail within within 30 days. The members are actively using healthcare coverage, and some of the examples are members who are pregnant or on chemotherapy, dialysis, methadone, MLTSS, personal care assistance, and private duty nursing. So the MCOs, they know that these members are using the services, but they have not responded. So they're going to do a special outreach to the high-risk members. And then if they lose eligibility, after the loss of eligibility, members, they will receive a letter from the health plan in addition to the termination notice from New Jersey Family Care. That letter will include information about returning to Medicaid if the renewal was not submitted, and accessing Get Cover NJ for affordable coverage through the state health insurance marketplace. So there's special populations that we have to make sure that we took care of, because not every eligibility is the same. So renewing eligibility is different for different categories of New Jersey Family Care. Some groups might require additional or different documentation. Our division will work with community and state partners to provide targeted outreach and information specific to specific eligibility groups, including the ABD members, which is age blind and disabled, members receiving services from the Division of Developmental Disabilities or the Children's System of Care, members who receive long-term care services through MLTSS, and members who have recently become eligible for Medicare. All members should make sure that they call 1-800-701-0710 to update their mailing address and respond to any mail that they receive from New Jersey Family Care. So what happens after the eligibility decision? Here are some examples of cases. And Halima, Hector, Samuel, and Sophia. Halima and Hector, they were determined eligible. Halima, she was determined eligible, and the eligibility continues, so Halima's happy. Hector responded or not, but he does not want to remain enrolled. We're going to talk about, so we don't have to worry about Hector because he doesn't want Medicaid. He doesn't want to have New Jersey Family Care anymore. So we're going to talk about Samuel and Sophia in detail because they were disenrolled and they want to remain in New Jersey Family Care. So what happens for Samuel? He responded to the eligibility mailing. He was determined ineligible due to income, assets, and received a disenrollment notice, and the account was transferred to Get Cover New Jersey. But because Samuel wants to remain enrolled, he's going to receive a notice letting them know that he has the termination notice included fair hearing rights, and he must have a fair hearing. He must request a fair hearing within 60 days. It's actually, this was just increased from 20 days to 60 days of the termination notice. Samuel can provide additional information in the meantime while his fair hearing is being processed. And throughout this whole process for Samuel, his account was already transferred to the New Jersey, to the Get Cover NJ. What happens for Sophia? Sophia did not respond to the eligibility mailing, was determined ineligible due to non-response, received disenrollment notice, but Sophia wants to remain enrolled. Sophia later tells her that New Jersey Family Care coverage will end because she did not provide needed information to complete the eligibility renewal. That happens often. We receive mail, we leave it in the kitchen counter, we do not pay attention to it, and then next thing you know, you're being disenrolled because they did not respond within 30 days. And Sophia at this point, she realizes she didn't send it, so she wants to remain enrolled. What can Sophia do? Sophia can actually respond to the renewal as soon as possible. And once her renewal response is received, the information will be reviewed. And if she's eligible, her coverage will be retroactive to the date of the original date. So she will have no gap in coverage. So if Sophia does not complete the renewal within 90 days of her information, a new application will be required. Of course, Sophia has any questions, she can call 1-800-701-0710. So if Sophia is not eligible for continuous coverage, she is advised to contact the Get Cover New Jersey to apply for coverage. Now, her application is not automatically transferred. Only the ones that are denied due to income are automatically transferred. So Sophia can go directly to Get Cover New Jersey and apply for coverage. How can community organizations help? Well, you can go to our state website, State Cover NJ. That's our unwinding website. You can get materials there that you can use for your social media. You can print and send out. Hey, you might actually find a video there in English and Spanish, and you might know one of the people in that video. So, and it's also in sign language, that video. Information packets and posters have been mailed to more than 6,000 community organizations. And of course, if your organization would like to assist community members completing the New Jersey Family Care paperwork, please email mahs.njfamilycare@dhs.nj.gov and make sure that you're put on the list for the training. Here's examples of what the website State Cover New Jersey looks like. We have information in English, Spanish, and 19 other languages. But because this is housed in a Google system, it has the ability to translate into many other languages. But the material that we do have is in 21 languages. So I told you before, some other states started their unwinding process already in February. So we heard from other states. There's scam already happening. People are receiving text messages and saying you need to pay us to renew your application. And we just want to make sure that New Jersey Family Care members know that we will never ask for money in a text message, and we will never pressure them for personal or bank information, account information, and we will not make threats about legal action. So we have flyers available for that also. The important message to share with our communities is call 1-800-701-0710 to make sure that we have your current address and contact information, and that you respond to any email you receive from New Jersey Family Care. After April 1st, if you believe your eligibility was incorrectly terminated, you have appeal rights. These rights are explained in the mail you receive. And if you do not have the letter or you have any questions, you can call New Jersey Family Care Hotline. If you lost your eligibility because you did not provide the information that was needed, you can provide the information within 90 days to have your renewal applications reconsidered. If you're ineligible for New Jersey Family Care due to your income level, you can apply for coverage through the exchange Get Cover NJ. And of course, we're in social media. You can follow us on Facebook, Twitter, and Instagram. And now I want to talk to you a little bit about Coverall Kids. That was one of the requests for this presentation. So what is Coverall Kids? Coverall Kids is an initiative to reach all uninsured children in New Jersey under the age of 19. This initiative provides New Jersey family care coverage to all income-eligible kids in New Jersey. And starting this year, in January of 2023, New Jersey expanded coverage to all income-eligible children, regardless of their immigration status. It became law in July of 2021. The initiative was implemented in 2 phases. The first phase was completed in July of 2021, and that eliminated the premiums and waiting periods, making it easy for people to enroll in the program. And of course, we did enhancement of outreach activities to increase enrollment. The focus there was to reach every children that was eligible but not enrolled, and focus on the U.S. citizens with qualified immigrant status. Phase 2, that started this year in January of 2023, expanded the coverage to all income-eligible children regardless of their immigration status. We continue the outreach activities to increase enrollment, but we focus more on the people without qualified immigration status. Who is eligible for the program? Children under the age of 19 who meet current income requirement are able to apply regardless of their immigration status. Applications might be submitted online at njfamilycare.org or by calling the New Jersey Family Care hotline, 1-800-701-0710. The benefits of the Coverall Kids program mirrors exactly the same benefits as New Jersey Family Care. And they're listed here. I'm not going to go through all of them, with the exception of the long-term care services support for people without qualified immigration status, because it will affect the public charge. For more information, you can visit our website, nj.gov, Coverall Kids, and learn more and apply. You will also have flyers, we have posters, we have Q&As, and a lot of information about the program. And that ends our presentation.